And now a moment from Your History and Health comes first with Dr. Richard Brown.
Hello, this is Dr. Richard Brown, and welcome again to my podcast. Your History and Health comes first. Your health and history comes first. All right, so how about where we are now? I mean, just think about where we are with this pandemic. And I want to talk about it continuously until maybe we get rid of it, which may be a while, according to our current behavior. But if coronavirus wasn't enough, and the Omicron and the BA.5 and other variants to make our lives miserable, now here comes something called monkeypox. Monkeypox. Perhaps you've heard of it, perhaps you haven't. You will hear of it. It is now with us. So we've handled a lot of diseases over the course of the population of the earth, and specifically in the United States. Public health has been a very strong part of keeping America alive and people well and out of hospital, starting from way back when we first learned how to make sure that water is purified across the country, and other various methods that science came up with to keep us alive. But it seems now that we're continuing to develop more and more diseases, bacteria and viruses, more rapidly than in the past. And I think it has something to do with the fact that, well, we're more advanced, supposedly. We're traveling across the globe more regularly. We are in each other's face and space and company more than we used to be. And there's places like huge concerts where thousands and thousands of people gather, and other events where millions and millions of people come together. And so I think we're going to be with these various diseases and mutations for a while. So let us get started about and learn about at least what we know now about monkeypox. So I'm going to speak to you from this article that was written by Dr. Purvi Parikh, and this was only published a few days ago in July. So the World Health Organization declared the rapid spread of monkeypox on July 24th. This monkeypox has now become a global emergency. The declaration of the WHO says it's the highest level of alert and that signs of monkeypox are significant and a great threat to the global health. And so it requires an international coordinated response. So an immunologist and allergist from NYU named Long Gone, and an assistant professor of medicine in the Division of Infectious Diseases and Immunology, observed a rise in the global cases a while back and identified that everyone is aware and should be aware of the symptoms and the risk involved. So it is important to know how to seek treatment, what the signs and symptoms are, how to prevent the disease, and how to get a vaccine, if there is a vaccine. Is there a vaccine? Well, let me tell you as we go. So let's start with what is the definition of monkeypox and what is it really about? Well, what we know at this point is that monkeypox is a rare disease caused by an infection with the monkeypox virus. So monkeypox virus is part of the same family of viruses as the variola virus, the virus that causes smallpox. Okay, monkeypox symptoms are similar to smallpox symptoms, but they're milder. And monkeypox is rarely fatal. Monkeypox is not related to chickenpox. Monkeypox was discovered back in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of monkeys kept for research. So, while we suspected that the coronavirus developed as a result of researching with animals, and then it escaped out of the lab, that was never verified. But in this case of monkeypox, research shows that in 1958, the outbreak did come from monkeys that were kept for research. And so, despite being named monkeypox, the source of the disease remains unknown. It was first found in the monkeys there, but they don't know how they got it. So they know that African rodents and non-human primates like monkeys might harbor this virus and infect people. The first human cases of monkeypox was recorded in 1970. So prior to 2022, the outbreak of monkeypox had been reported in people in several Central and Western African countries. Previously, almost all monkeypox cases in people outside of Africa were linked to international travel to countries where the disease commonly occurred and through importing of animals. These cases, occurred on multiple continents. So you've seen movies and you've heard about there being restrictions on transporting animals from different countries to the US. It is specifically because we have learned that some animals do carry diseases that may not be in our country, and we certainly don't want them to come without us knowing about it, and or if we know about it, then we certainly won't let them in. There's actually certain fruit that cannot enter our country from other countries unless it has been inspected and that we know that it will not infect the fruit crop that's already in the United States. So you might think at this point, well, what does it look like? How do you catch it? What is it? Do I have it? Well, let me tell you. These are the symptoms. They can include fever or an elevated temperature, a headache, muscle ache, backache, swollen lymph nodes. Now, these symptoms are similar to COVID-19, which we've talked about in the past, and that is still with us. But it's a little different. Swollen lymph nodes are also a sign. Now, what are lymph nodes? Well, lymph nodes are part of the lymphatic system that exists in all your body. Just like you have a skeletal system, a circulatory system, you also an immunization system, an immune system. There's also a lymphatic system, and this lymphatic system is located throughout the body, but the large places where the lymph nodes are includes in the neck and under the armpits and in the groin area. So the lymph nodes have to do with controlling and or responding to diseases, because it's actually part of the immune system, and it helps with the proper functioning of the immune system. Another symptom or chills or exhaustion. So let me run through that again. So you may get fever, you may get headache, you may get muscle ache, you may get backache, swollen lymph nodes, you may get chills, or you may get tired easily, exhaustion. And finally, you may get a rash. Now, this rash comes in different appearances. You may get small pimples, you may get blisters that appear on the face, you may get it in the mouth, you may get it in other parts of the body, like the hands, the feet, the chest, and the genitals, or in the anal area. So these rashes go through different stages as well before they heal completely. The illnesses typically last 2 to 4 weeks, and sometimes people get a rash first, and then they get the symptoms. And sometimes other people experience the rash and the rash only. So, treatment. Well, first, there's bad news about the treatment. Unfortunately, there are no treatments specifically for monkeypox virus infections, at least not yet. However, the monkeypox and smallpox viruses are genetically similar, which means that the antiviral drugs and the vaccines developed to protect against smallpox may be used to prevent and treat monkeypox virus infections. So there is an antiviral medicine that's used called tecovirimat, and that is recommended for people who are more likely to get severely ill, like patients with weakened immune systems. So now it appears what we know now is that sexual contact is the most common form of transmission. And although it is possible through close contact of droplets as well, we know that it is the skin-to-skin contact that pretty much is a major source of transmission. And so it's important to use protection when participating in sexual activity, and also using masks indoors when you think you're going to be close enough to people that they may spew droplets that may get on your skin or in your respiratory system. Like the coronavirus, it gets into your nose and throat and damages your respiratory system. So these factors put people in danger of getting of monkeypox. I'm going to list several of these that we know now that can put you in danger. So, multiple sexual partners. Now, we know about this with the sexually transmitted diseases. We know that a risk factor in getting any sexually transmitted disease is multiple sex partners. And so it is true with this monkeypox. We know that with gonorrhea or syphilis or herpes or some of the other sexually transmitted diseases, that the more sexual partners you have, the higher the risk is for contracting a communicable disease, a sexually transmitted disease. Okay, number two, immunocompromised individuals. If you know that you're already immunocompromised, then you're at high risk for attracting this disease if you come in contact with people who have it. Also, traveling to places and areas of the world that are very high in the rates of monkeypox, is also a risk factor. And to protect yourself against this disease, you just might not want to travel to those places where it has been identified that there's high incidences of monkeypox. Now, since we're just learning about this and talking about this over the last few weeks, we don't even know yet, at least they haven't told the public, where some of those places are that are highly contagious with monkeypox. But there are some other places that have been identified that are high-risk places for catching monkeypox. So it includes hanging out with sick people, okay? People who are sick, you probably need to stay away from people who are sick. If there's family members that you know are sick, you're planning to travel and visit with them or be in their company, and they're not feeling well, you probably need to just cancel that trip or not get in their company, because we just don't know what's going on with monkeypox as much as we know about COVID-19, and we know what we need to do for that. And it's pretty much, we think, the same things you need to do to protect yourself from COVID-19. You need to protect yourself for monkeypox. So the symptoms, as I mentioned, includes the same symptoms as COVID-19. So another place that you should not go to, where you're more likely to catch COVID-19 and or the monkeypox, is visiting your local bar. Okay, grabbing a drink and and hanging out with people in the local bar, large crowds may not be a good place to go right now because of the loud noise and the loud screaming and the dancing and the frequently touching. Just not a good situation. Hugging, of course, we reduced the level of hugging from what we used to do since COVID has been around. But hugging a friend and hugging people and saying hello and goodbye in common places is probably not a good thing to do right now until we get some control over this monkeypox. So places like weddings and actually funerals and large gatherings, you should do what you've been doing in terms of social distancing and masking if you go to these places. So this last couple of years have been really terrible, devastating, disappointing because we've had to stay away from each other. And now that things are opening up a bit, here comes monkeypox. And so now we have to continue to be careful and be safe. Going to church is still another place that is a source of where the disease can spread. Lots of singing, lots of talking, lots of hugging, lots of just being in contact with each other. Drinking from the same cup is not a good idea anymore as well. So please be aware of these places. Now, all of this probably sounds scary, and there's some people that say, oh, I can't pay attention to that. I got to live my life. And that is true. I'm just saying, be cautious, be careful, be mindful of what the possibilities are out there. I mean, going to the barbershop, hair salons, again, are places where you can physically come in contact with the virus, both monkeypox and COVID-19. Cruise ships, as we know, is the first place that we learned about the coronavirus, the outbreak that took place there. And so still it's a source of where it's not a good place for you to go if you want to avoid monkeypox. So how do we prevent this monkeypox virus? Well, I've mentioned a few of those. Others include avoiding contact with infected animals, especially those animals that are sick or dead animals. You want to avoid those. Now, I know in America, we love our animals, our dogs, our cats. I was talking with someone the other day who has a sick cat. They're spending lots of money to try and figure out how to perform surgery or not perform surgery, or to just euthanize the cat. And so I know they're spending a lot of time with that cat. And he's got a large, huge bump on his head. It could be monkeypox. I don't know. They don't know. Matter of fact, I haven't even discussed it with them. But that could be a source. So you want to avoid infected animals, sick animals, and the bedding where animals have slept, because that material could be contaminated. Also, is being recommended that any meat products that you cook should be careful with that in animal parts, because you should make sure that it's not infected, or certainly thoroughly cook them to keep from getting infected. Washing your hands, of course, is a universal safety caution that you should use with soap and water, same as COVID. Avoid people who are infected with the virus, makes sense. Practice safe sex, including the use of condoms and dental dams, wearing masks, covering your mouth, nose, around others. Continue to clean and disinfect. Frequently touched surfaces is also recommended. So what is the difference between monkeypox and chickenpox? You might want to know, or you might not. I might have scared you enough that you just want to stay in the house and not visit anybody and not go out at all and wait till it all blows over. Well, based on the current behavior of people, it probably isn't going to blow over very quickly, because we aren't following rules. We aren't adhering to the science and the safety that is out there. But although both the monkeypox and chickenpox cause the skin rashes, monkeypox and chickenpox are different viruses. The monkeypox is a orthopox virus, is what it's called, an orthopox virus, while the chickenpox comes from herpes. It's a herpes virus. But both can be spread through skin-to-skin, prolonged face-to-face contact. But chickenpox is very contagious and spreads more easily than monkeypox. People with monkeypox are more likely to have the swollen lymph nodes than people with the chickenpox. The rashes are different too. The chickenpox rash appear in waves. The monkeypox sores develop at the same time. And the chickenpox symptoms, including the rash, tend to get better within 2 or 3 weeks, while for the monkeypox, it takes 2 to 4 weeks or even longer. So there was a note from the Cleveland Clinic that I read that said that the last 2 years have been incredibly challenging, talking about the COVID pandemic. But the monkeypox is a rare disease. It's spread through close contact by kissing and sex and through close contact with humans. And so we're still learning about this this monkeypox. And of course, he says that the best way to protect yourself is to avoid contact with people who are infected. So after going through what we've gone through with the other diseases, we now have to deal with monkeypox. So please be aware, stay the course, get vaccinated, talk to other people, have them to get vaccinated, and be very, very careful about being around other people who are sick, and very careful about not practicing safe habits in the company of large people. So that's all I have for this session today. Remember, your health and history comes first. I'm Dr. Richard Brown, and I'll see you around.
This has been Your History and Health Comes First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.